Please welcome to the stage Jonathan Epstein, Dean of the Perelman School of Medicine, Executive Vice President of the University of Pennsylvania for the Health System. John, thank you so much. Big round of applause. So thank you. Jonathan, we've been having a marathon today. Today's a marathon of back-to-back discussions with different leaders and innovators and thinkers in the kind of, not only just the American healthcare ecosystem, but really the global in many ways because of the impact of what's happened here. I know that you changed your entire day and commitments to be elsewhere to be here today. So first of all, big thank you to him for doing that. He's one of this. And if you don't know how important the University of Pennsylvania is in all of this, so we're talking about the AI moment and what AI is already changing in medical research. You're seeing around the corner. I don't know what in the heck your big news is. No one said, hey, your big news. What's your big news?
Well, first, you were saying such nice things about me. I wanted you to just
Well, he's the
keep
Joan
talking
of Arc
for a while,
of science. I need to figure out what you are.
Thank you so much for saying that. I think Sadiq was very nicely referring to some work from my own laboratory that wasn't AI and wasn't what you're asking about, but
mRNA.
mRNA.
mRNA's next chapter.
Exactly. The advances that we've made over the years have led to or have contributed to the idea that we might be able to engineer the immune system in the body, as opposed to taking your cells out and engineering them in a dish and growing them to make CAR T cells. We've come up with a way to use mRNA to directly target T cells in the body. And John Crawley was talking about the importance of bringing the cost down.
So you're going to win the Nobel Prize?
No, but I was fortunate to work with people who have won the Nobel Prize. Drew Weissman and others, and others who should win the Nobel Prize, like Carl June, to advance this approach.
And I just want to acknowledge my business partner, Richard Vague, who's on the board of Penn Med. Carl June is the Richard W. Vague Professor of Immunotherapy. Right. So there is a little bit of a connection. So if Richard had anything to do with you getting down here, thank you, Richard, very much. But you know, I don't know if you've heard very much of today's forum, but we really are interested in bold bets, right, and what it takes to make them. You've been making them. I think you're probably genetically designed to make bold bets. What are the lessons in terms of bold bet making that you think we in the room, particularly in the policy space, but other parts of the healthcare ecosystem could learn from in terms of the wild leaps you've been making?
Yeah, so Zeke Emanuel likes to say that 4 of the 5 greatest breakthroughs in biomedicine in the last couple of decades happened at Penn, and I'd like to hear Zeke say that. But gene therapy for curing blindness, mRNA therapeutics, CAR T cells, new Alzheimer's drugs, they all started at Penn. We weren't the discoverers of CRISPR, but we were the first to use it in people, with baby KJ and curing an inherited metabolic defect. So we have contributed to a lot of breakthroughs, and we like to say that each one of them is an overnight discovery that took 20 years to develop. And I think one of the tricks is that we're able to take the long view, and we're able to invest over decades in ideas. And that's why we need academic institutions to couple with the private sector, because most companies can't take that long a view. They're mostly focused on quarterly.
We feed people what? This is the United Airlines model. We feed people in their seats and keep it going, no break. Is the lunch any good? Yeah, good. Okay, thumbs up. Excellent. So you're doing that, and so as you're kind of putting these things together, one of the things I'm really interested in is the economics of science and innovation and how you bring them to a product. I mean, Lilly, one of our big sponsors, BD and others, when you're kind of looking at the economics of science innovation research, until I got into the guts of some of the GLP-1 stuff and began looking at it, it's really hard. Like, it's staggering. I would never go into the business that they're in. Sorry, guys. But what I'm also interested in is how it gets from the lab to become a product. And what I've learned from Richard and others is there's something called you have to go through the valley of death. Yep. I'm interested in how much science is stranded because it can't get in through the valley of death.
Yeah, I think it's changing rapidly. And I think that...
Is it better?
It's gotten better. And I think, I've been running my own lab for 30 years. And when I started, I think we thought our goal was to publish papers and hope that a company read our papers and picked up on it. And a lot of stuff died in that intervening period where nobody picked up on it. And I think what we've learned through a number of successes, some of which I mentioned, is that we need to carry the ball farther and partner with the private sector to make sure things don't get dropped in that valley of death. And that means spinning out new companies that we remain close to until they pick up momentum and bring in enough capital to bring those ideas forward, or work directly with partners in pharma to translate an idea, or build the infrastructure for clinical trials so that we can move an idea from the laboratory to a clinical trial so it gets the attention of the private sector to be built out. And I think at many of our academic institutions, that's happening much more than it used to. And not all, but many. So I think we have improved over a couple of decades on that valley of death.
How is AI changing the game? Or is it?
You hear it at every conference you go to.
Yeah.
AI is changing everything.
Is it?
And that is true.
It is.
Yeah.
So can you disaggregate it so I can understand what is changing in what part of AI? I hate the AI. I like how Jensen Huang is talking about this 5-layer cake because you can, take pieces of it and, think about it in bits and pieces, and communities can figure out how they can maximize some portion of this. AI has just become a blob to describe and define everything, but you're smart. You're also, I want people to know that Jonathan is a competitive ultimate Frisbee player. So I want to know how AI.
I don't know how that's relevant.
How has
to
AI affected your Frisbee game? But
it hasn't made it any better.
Yeah.
But I give you 2 examples. I mean, I could give you 100 examples, but 2 examples of how we're using AI right now to advance the development of new medications. One is in the area of what we call immune health. And if you think of genomics and genetics as, what you're born with, the blueprint you're born with, we think of your immune fingerprint as what your exposures have been,
right,
and how your body records each one of those exposures. Your immune system is a built-in sensor of everything you experience. And if only we knew how to read the language of the immune system, we would know whether you're responding to a medicine, or whether you were sick, or whether you had cancer. And we can actually read millions of parameters of the immune system, but that becomes a big data problem. And AI is perfect for finding associations between big data streams and outcomes. And so we can couple that with your genetics and with your imaging results and your electronic medical record data. Now you've got a lot of data, and we can start following patient cohorts and ask, for instance, in a patient with multiple sclerosis who's treated with one of 6 different approved medicines, but nobody really knows which one is going to be right for that patient. We sort of try them and then move to the next one. We can predict after a single dose whether that patient's likely to respond or not. So we're using that in real time right now to develop those predictive models and algorithms. And I'll give you a second example. I talked about CAR T cells.
Yeah.
And I'm very interested in CAR T cells. The whole goal with CAR T cells, or with radiopharmaceuticals, or with delivering lipid nanoparticles, is to find the right binder that brings that therapy to the right cell in the body. And that's a big problem, and it's very slow to do it cell by cell, trying to find the right binder. But there's a paper about to come out in Cell, I'm sorry to say.
Oh, I don't like
that uses AI to go
I knew there was
through-
going to be tension.
There's tension.
I counted on it.
Science probably rejected it, I don't know. But to go through all public databases of cellular expressed proteins and find unique markers or combinations of markers on specific cancers or specific cells. So now you could imagine finding binders for any cell you want. And that, again, is a perfect AI sort of problem. And now you can make your binder by using AlphaFold or other AI-driven algorithms to actually design the molecules that would become the binder as well. So this is going to hasten drug development quite dramatically, I think. So those are a couple of examples.
How vulnerable is that ecosystem, that creative ecosystem that you've described, to the things Sudeep was talking about, which is cuts in NSF funding. I mean, on one hand, when I'm listening to all the things you're talking about, we're talking about industries that will be hundreds of billions of dollars of value, even more than that, and the life impacts are going to be staggering. So part of me is saying, who cares about $9 billion for the NSF? It's such a dinky amount of money. But on the other hand, what is Penn less immune because you have developed, you're like the Silicon Valley up there of advanced medical research, or are you worried about this eroding sets of early government investments?
Yeah, I'm certainly worried. I'd like to say this is the best of times. These are the worst of times. The possibilities are so enormous, and the chance that we could accelerate drug development are right there in front of us. And at the same time, our knees are being taken out from below us from these actions, and it is having a profound effect today on the early parts of the pipeline.
So if you had a message for this town, what it would be on that?
It makes no sense to me from an economic point of view or from a health point of view, to cut off the pipeline at the very start. We had to cut our graduate student teaching slots by a third because of funding cuts. So we're going to train less, and those are the people who go into industry and make the next discoveries. The amount of money it takes to start one of these breakthrough projects, this company I started, it was called Capstan Therapeutics. It began with a $2 million gift, and it raised $350 million, and it got bought for $2.1 billion. The amount of money it takes at the beginning is tiny compared to what can be developed. And every economic impact study shows that. So never mind the disease is cured. Purely from an economic point of view, I don't understand the approach of making it harder to keep this engine running. So that would be my message to Washington, D.C.
One of the areas you've really focused on, I'm told, is moving science from the labs through translational steps to get this to patient care. A lot of what we talked about today is also about patient care, the interface with the patient, and the kind of psych there. When we had our friend from Lilly up here, he was saying his obsession is accessibility, reaching more and more people. What are your insights on what has to happen on that? Because I do think there is simultaneously enthusiasm in the country about science, but also kind of anxiety and irritation that so much of it's so far away from them, right? So
yeah, I had a call from a Penn student who had graduated, was living in Louisville, Kentucky, and she has a rare genetic disorder, and there's a treatment available for it, but she was told she would have to wait 6 months to get insurance approval for that therapy, and meanwhile she was suffering from it. It just makes no sense to me. As excited as I am about the scientific discoveries, we have a healthcare delivery problem in this country that we certainly need to take on. There's access problems, there's cost problems, there's too many middle people in the process of approvals that slow things down. So we do need to take those on. And I only wish we had the time and energy to take those on instead of dealing with some of the more mundane issues that we're consumed with.
Another thing, I've always sort of thought America was designed to be the brain drain problem for the rest of the world, that the smartest, coolest, best people were going to come to this country, and apparently a lot of them end up at Penn. But I think if you look at science overall, I mean, you kind of look at how we've won wars in the past. Guess what? We've had smart people over here who've been part of that equation. So I am very pro bringing brains over here, university training, having these people root and seed and root companies here. And I remember I wrote an article when Bob Gates was head of Texas A&M University, our former Secretary of Defense. We co-wrote pieces in the New York Times together about America's talent problem and talent pipeline, but that was after 9/11, and when we were blocking everybody from coming in the country. What impact? I want to kind of hear from you about, because when you talk about cutting, graduate assistant spots, but all this, are you seeing the composite of talent coming into this country changing? Is it changing dramatically? Where is it going?
I think we can both speak to this.
Yeah, absolutely.
Yeah.
I can start. We're going to be, we have been this past year, the first time in my lifetime a net exporter of scientific talent. That blows me away. That has not happened in my lifetime. And it's because of a couple of reasons. One is that we are, when you put out into the world that you want to cut the funding for science, it just tells people, well, maybe I should go somewhere else. The second is that...
And where are they going?
Folks, part of it is they're staying where they were. So if they are in China, they now have choices. They can go to Peking University or Tsinghua, and these are excellent biomedical research and other types of science places. In Europe, they go to other countries in Europe. The UK is a big draw, right? Oxford and Cambridge are really seen as world class. And so there are competing places, and Canada is huge for Americans to go there. Now, I'm not an idiot. I understand that when you look at the total dollars, the total euros involved, Europe is not going to be taking all the scientists out of America. That's not going to happen. What's going to happen is that we're just going to have less potential energy of those scientists here, less breakthroughs, because if a third of those graduate students aren't going to Penn, that's a third of the people that would have been there to try and cure cancer, to try and cure Alzheimer's, to attack the problems that we want to attack. And they're just not going to be there. And the really dangerous part of that is that you don't know it. You don't know what you missed out on. And we've been an extraordinary country that has not missed out on a lot, but we're really playing with fire.
What are you seeing in your students?
We've lost some faculty to Canada, to Europe. Some faculty members who had moved from Europe to the US are like, I'm out of here, going back home. And we get almost no postdocs now from overseas. The visa issues are too difficult and slow. And that used to be a major pipeline for our laboratories, to have postdocs coming from overseas. So it's been a palpable change. It's quite dramatic.
Do you work with any of the big platforms out there like Google or Anthropic or others? Are you beginning to see some of your work go in and be? Because I remember years ago at the Aspen Health Forum, we were kind of trying to do what we're doing today, de-silo some of our discussion in health. So we had some Google guys came in and they, basically, guess what? They're really good at information reorganization processing. But we were talking about this like 8, 9, 10 years ago, and before people were really even used to understanding what that meant. But are you finding yourself interacting with these players?
Absolutely. And in both the health system around delivery of care and the other aspects of managing electronic medical records and health systems, but also on the fundamental basic science side. But there's a little bit of a discrepancy between solving problems today with AI, where in the healthcare sphere, many of the big Google, Anthropic, et cetera, don't yet have the usable solutions. They're still building big solutions. Right. And there are small companies that have built usable solutions you can put in practice today. So there's a little bit of a dichotomy in whether you...
I like how you started at the beginning kind of talking about personalized medicine, what's possible. And I do find there's this tension between the macro and the micro in this field. And there's a tendency to want to see all the financial economic benefit in finding one size fits all macro. But really the brilliance is going to be able to create cheap ways to be micro, right? Is that largely correct?
Yeah.
And is the science going to take us there in a way that helps that individual and that person's healthcare and their personal tapestry of all the things you just described in a way that they're going to be able to afford?
Yeah, I think it'll improve access tremendously. We already have the ability for Penn Medicine patients to use an AI chatbot essentially to get triaged to the right place and to get an appointment quickly. And it works remarkably well, and hopefully to steer them to a person when the chatbot isn't good enough. So I'm worried about it making mistakes, but it certainly improves access.
Since you changed your, go ahead.
I'll give you just one other example. There's something called Chart Hero that goes through all your medical records and makes a really concise summary of your medical history, and that is so useful if you go to an emergency room, see a doctor you've never seen before, and they can go through all of your past records, because a physician could never spend the time to do that, especially if you have a complex medical history, in the 5 or 10 minutes that they have to see you. So that's a game changer.
When you're with all your CAR T-cell stuff, and you're like it's amazing, just so the audience knows, you're recognized for your deep understandings of everything around congenital heart disease, heart failure, stem cell biology, epigenetics. You're big in this area. If you had had Claude way back when, would you have done more?
No question. So look, when I started, I was sequencing DNA manually and running big gels, reading each base pair one by one. I mean, the speed at which stuff gets done these days is enormous. And of course, we would have done more.
That's fascinating.
If we had those tools.
So you change your entire day to be down here. Do you want to hang out a little bit more? I can get rid of Sudip, and then we can hang out a little bit more.
Sure.
Okay, Sudip. Let's give a big round of applause to Sudip Parikh, President of the American Association for the Advancement of Science. Sudip, thank you, buddy. All right, so why don't you sit right there, and I'm going to bring up on stage Garth Graham. He's Director and Global Head of Healthcare and Public Health at Google YouTube. So, Garth, thank you so much. We've already been talking you up a little bit. Hey, thank you so much. Well, I always got to find out whether there's going to be tension or are you guys going to like it. He might have said Google's just a waste of time. You never know. You never know. Meet Jonathan Epstein. So here we go. I'm having fun. I hope all of you are. It's kind of, so Garth, you heard what, I should also say, you're a cardiologist, you're a public health expert, you're at Google. And I guess, when I sort of felt avant-garde at the Aspen Health Summit, this is back when I was at the Atlantic magazine, having Google in the room with health people. Like we brought Google in the room. This is a decade ago, a long time ago, and I remember being at your, I used this joke this morning, but it actually was true. It was with Larry Page and Sergey Brin and Eric Schmidt at a dinner years ago, and they said, maybe we can use technology someday to end death. And it was a big, big statement. It was at a dinner hosted at Eric's home, and a couple of the DC types in the room said, boy, that's going to be really bad for entitlements. But in the old days, Google was not thought of as a place, a platform that would be relevant to the health world.
Yeah.
And you saw it come in and actually become, very, very big, processing information, becoming big platforms. Jonathan was just sharing, some of this as well. But maybe you can help give us a picture of what the state of play is today.
Sure.
And how embedded you are in the national health innovation picture.
Yeah. So, any of you, if you wake up and you have a runny nose and a blue toe, and a pink eye, what do? You look it up. And if you're sitting after having a complex conversation with your oncologist or something late at night and you want to know about an experience that other people have had with that disease process, you look for a video, you look for something to understand your experience. And I often say this is not a esoteric phenomenon. Everybody in this room does that. And so we're very much a big part of the healthcare system because we drive healthcare journeys. We drive the kinds of decisions that individuals make on a minute-by-minute, day-to-day basis. Most healthcare doesn't happen in hospitals. It doesn't happen in exam rooms. It doesn't happen necessarily on an OR table, although very good healthcare happens there. Happens before all of that, before you get to these points, and the day-to-day decisions you make about what you're going to eat, where you're going to go next, the decisions you make for your kids, all of those things. And so information has been a big driver of that. And Google is the #1 search engine in the world, followed by YouTube. YouTube is the biggest video library in the world, and everybody comes to us for all kinds of information about how to fix their fridge. And then cardiologists may look up about how to fix the RCA with a stent or surgery. So we're a big part of the healthcare ecosystem because of the context that information does in terms of driving health outcomes.
Is that system, it's, how do I ask this in a polite way? It's largely free, right?
It is free.
So it's free. How is that presence, that interaction with patient care? We were talking about taking tech from the labs to the patient care. Why hasn't your just blob, your blob out there, a big presence, decreased the cost of healthcare?
I think healthcare is complicated. I think there's nothing simplistic about healthcare in the United States or globally. And so the connection between cost and outcomes, I think, has been nebulous. I'm in DC, where everyone in DC understands that concept really, really well. But I think what we've done a really good job of over the years is really systematically improve information quality and the kinds of things that people are seeing and interacting with. And so we've seen this engagement on healthcare information grow year over year over year because people feel confident in information that they're getting. And so that's one role that we play in addition to some of the other roles around AI, as we were just talking about, and some of the other more intricate roles in the context of healthcare delivery. But one very kind of basic thing that we do is we help billions of people around the world every day make some important decision, whether it's a small decision about whether they should, eat peanuts versus candy, or something big about whether understanding BRCA genes, or something even more complex.
We've got Jonathan Epstein here. I would love to hear how you sort of see the AI world and what you're doing in your platforms interacting with Jonathan and vice versa. You have a colleague named James Manyika I've known for years, so give him my regards. And James is like he's like the Yoda of this in Google land. But he starts out talking about advanced scientific achievement and innovation and how the tools that you're bringing to it are going to be embedded in it now forever and it's changing the game. And I don't know, Jonathan, you feel that, but James is such a messianic force in that message. But is that happening?
Yeah, I mean, I think an earlier discussion was on some of the things that's happening with understanding protein structures. I mean, you've known this from your career. Going from protein to an actual clinical compound has a lot of steps that has taken many, many years. And now AI allows us to configure and understand those configurations. And those concepts dramatically improve pharmaceutical delivery, the kinds of things in terms of outcomes. So there's so many different aspects in which AI plays a real role in healthcare. And I think for us, one of the things I think that we've learned and done really well is do good in all of those areas. Work hard in terms of delivering information quality, work hard in terms of working with other leaders in the healthcare system, and then work hard on solving some of those concepts around basic science. That's particularly important.
Jonathan, what do you think about that interaction? Is it where it should be?
No, I think it's absolutely right. The only thing I would add, and I said it to the medical students at their graduation this year, is that all these natural language models are built on known information and known data. And what I said to them is your job is to create new knowledge that the future models can be built on. And I do worry that if we only
don't get trapped in Google.
Well, it only knows what it knows.
Yeah.
And it has to have something to be trained on. And so if we believe that it is all powerful and has all the knowledge, we'll stop learning new knowledge. So we have to be careful to still empower people to create new knowledge and make new discoveries that can then be put back into these models.
One of the things I'd ask you both, and I don't know if other people have had this experience, but I share my personal stuff and tell people where I'm at. My mom died of breast cancer, but she was in there for a while. She lived in anybody from Bartlesville, Oklahoma? I'm always interested to find out if there's anybody. Paul DeBar, who's the Deputy Secretary of Commerce, is from Bartlesville, Oklahoma, and I found that out by asking in a room like, anybody else from Bartlesville? Anybody been to Bartlesville? No.
Okay.
Yeah? What, you have been? There's somebody where?
There's one,
I've even been there.
Where? Oh, are you from Bartlesville? Okay, good. Well, that's good. Phillips 66 is from there. Frank Lloyd Wright's only skyscraper is there. It's kind of a cool place. But the healthcare system there, with all due respect to Bartlesville, kind of sucks in my view. And when I interviewed Sid Mukherjee about his book, and I read every word of that huge book on cancer, I realized that my mom had been subjected to things that already had been invalidated by science because she was in a part of the country that was not yet literate, I would say, in that. So we moved her to Dallas, and some of the problems that she had were improved there. Then when I finally moved her out to the Eastern Shore of Maryland, we were close to Johns Hopkins, she got much better things. So I faced real world reality about my own ignorance, but also the unevenness of treatment, of care, of science around there. So one of the questions I want to ask you guys, because you were talking about translational science and getting this to patient care, is how big a lift, and can you solve the lift literacy, as achievements are happening so fast, how do you bring along the medical profession? How do you bring along the interface with the patient so that you're getting, whether you're in Bartlesville, Oklahoma, or you're Tuscaloosa, or wherever you may be, you're going to get some higher bar of engagement in American healthcare.
Let me
You don't all have to live outside Johns Hopkins or Penn.
Let me challenge one of the premises that you
Go ahead.
in your statement. I think it is important to uplift certainly the healthcare providers, the healthcare ecosystem, but patients. We have to empower patients with information about their own care.
Yes.
Families with information about their own care. Caregivers, all of those things. Because what you're finding nowadays is the idea that all the information, the expertise in the world was locked away in the New England Journal or Nature Medicine or some of these places where we love to publish it, and that's where it is. That's not where it should be. It should be in conversations at the dinner table. It should be in walks that people have amongst their family and they're talking. It should be all these different places and in clinical rooms as well. And so the one thing I would say around the concept you just mentioned is we have to think through both how we empower clinical systems, providers to do well, but we also have to empower patients in terms of their own journeys and their families.
I think it's really important. Now, I'm going to bring up in a minute a man I think is another hero in this story. I really respect Brad Wenstrup, the former member of Congress. He was co-chair of the Doctors Caucus. He's a war veteran and was treating people on the fields in Afghanistan. And he is out there. He's created Americans for Health Excellence about this. It's really about how to give patients agency in this process. But he's also basically saying, guess what? Even patients that get empowered and informed can still get screwed.
Yep.
And so it's in the ecosystem here of patients getting screwed, maybe insurance coverage, whatever. There's some really big gaps and problems. Is there any tilt that you can bring in? I always kind of look at it and said, you're either making your own weather or you're getting rained on. How can Google help change that equation?
Yeah, I mean, I think healthcare delivery is complicated. You know that very well. And in terms of simplifying these processes, it takes a number of steps. But I do think the capacity and the ability to simplify a lot of the back-end dynamics that happen with healthcare so that clinicians can do their work and become clinicians and not necessarily be engorged with paperwork, and administration is particularly important. So I think that part is good. I also think, the more we can create more transparency in the process, I think that helps both patients and the system. So I think a lot of what you see in terms of a lot of the partnerships that Google has had with healthcare systems has been around improving that ecosystem, some of the things you were alluding to before, I think that's important. But healthcare requires so many different components of the players on the field to be all moving in the right direction. And so I think we don't necessarily want to simplify it, but understand kind of the various roles and responsibilities.
Jonathan, if you're going to ask them to fix one thing that they're not doing well, what would it be?
Well, let me just say, I think your comment about democratizing access to information is terribly important. We heard a lot of that when social media started and the internet was born and everybody was like, it didn't always turn out so great in terms of misinformation.
Right.
And so I think we better make sure we do this right. And if we're going to give people access to powerful AI models, they better get it right when they provide that.
What's frustrating me is I go
that's
up
what
there.
I would ask of Google.
I go up there and ask about healthcare things, and I get these damn lines: call your medical provider.
That's
call
the right
your doctor.
answer.
And I want them to just give me all the answers. And I don't want to call a doctor.
No, but that's
look at vaccines and the information that's out there about vaccination. You can find whatever you want to find. So we need to make sure somebody's vetting the information.
Well, just as we close this up, I'd like to hear from both of you, as you sort of in this bold bets frame that we brought to today, just be interested as you're kind of rolling the dice. And I just want the country to know that Jonathan Epstein, we would be so screwed in our health and country if you didn't exist. So thank you for
not what my wife says.
Thank you for your lab. Thank you for all the innovations that you brought forward. You're an incredibly accomplished yet modest person, which I appreciate. And Google, you're too big to ignore anymore. So I think you're really big. So, but I'm just interested again, as we all are, if we're kind of put our resources and minds and thought together, in near term to give our audience and those that are going to be watching this, I think this is going to have a good echo and surround sound effect after this conference. What should be, what do you see coming down the road, or what would be the bold bet worth making that we need to get our heads around? Jonathan?
I think we should continue to bet on bold new ideas, on creating new knowledge, and not worried so much about how it's going to pay off in this quarter.
Right.
Create new, great knowledge, and we'll find great uses for it and innovative new therapies that will come from it.
Garth, same from you.
I think healthcare moves at the speed of trust. It's what the decisions that people make and the system that helps take care of them when they make those decisions. And so I think it's important that we empower patients. I think it's important that we understand the importance of high quality information, to the point you brought up, which is an excellent point. For us, we take information quality very seriously, and that's why we have credible sources and index on clinicians, et cetera. But I think the era of healthcare just being locked away in the silos of journals, textbooks, I don't think we're there anymore. And so the future is just more and more of this idea of how we empower patients in the journey and meet them where they are.
Great. Well, let's give a very, very big round of applause to Garth Graham, Director and Global Head of Healthcare and Public Health at Google YouTube, and the great Jonathan Epstein, Dean of the Perelman School of Medicine, EVP at University of Pennsylvania Health System.
Thank you so much.
Thank you very, very much, Jonathan. Thank you.